Okay, so I believe we have people already in the audience, so we'll begin. So I'd like to start by welcoming everybody. Thank you so much, colleagues, partners, friends, for joining us today on this very excited webinar around integrating social sciences evidence for pandemic policy making. I'm Dr. Uzma Alam from the Science for Africa Foundation, and I'm delighted to be co-hosting this session with our colleagues from the Kenya National Public Health Institute. And as you'll see, our two fellows today, have been working tirelessly around really thinking of the role of social sciences in pandemic making. And our first speaker will be Teklu, who's actually a Delta's Africa Fellow, which is one of the flagship programs here at the SFA Foundation. And under Delta's, he was also a recipient of the Community Public Engagement Seed Grant and the Individual Policy Exchange Program, while Professor Kellen is also an SFA Fellow under the Possible Program, which is a program targeting social sciences and humanities. And with that said, before I hand over to Dr. Leonard, I'd also really like to acknowledge all our different partners and collaborators on acknowledge on the different slides for the different roles and support they've given us so far. So with that said, Professor Leonard, if I can hand over to you.
Yeah, thanks, Prof. Uzma. I'll go straight. You can click the next slide. So I'll start by introducing the program. We'll highlight. I'll introduce the two speakers. Once I've introduced the two speakers, each speaker will be given 15 minutes to take us through their presentation. And then after that, we are going to have 30 minutes of question and answer. So as the speaker goes through, we can note our question and answer down. And then we'll have closing remarks being given by Salome Wawire. So I'd also ask Salome to share some of the ground rules as after the introduction of the speakers. Next.
Okay, thank you very much, Dr. Kingwara. Just a bit of housekeeping to remind you that you should keep your speaker muted unless you're speaking, so that we are able to minimize the background noise. Use your headphones when you're speaking, because that helps at least with the quality of the sound and avoidance of echoing. For the camera, please just turn it off, but put it on when you are speaking. And we have, like Dr. Kangara said, we have a chat box. So if you have any thoughts, any questions, please post them there. And then if you have a question, a comment, you could raise your hand and we will get to you to allow you to speak. Thank you.
Thanks, Salome. So I'll introduce our first speaker. I'll introduce our first speaker, Teklu Cherkose. Teklu Cherkose is a social science researcher and a PhD fellow at the Armauer Hansen Research Institute in Ethiopia and at the Delta's Africa 2 Africa Leishmaniasis Consortium. His work investigates how health interventions can effectively be integrated into community. Using a mixed method approach, he examines the interplay of actors, interventions, and context by integrating patients, community, and stakeholders' perspective, ultimately aiming to shape effective and sustainable health policy. Mr. Cherkose also is a grantee of the African Pandemic Science Collaborative Individual Policy Exchange Program, what we call IPEP, and today is going to give us a presentation on a topic titled Social Science Evidence by Pandemic Policy Making, Lessons from Kenya and Ethiopia. He's interacted closely with the policymakers from both the two countries, and I know some of the policymakers are within the discussion and they'll greatly enrich the discussion. Next. Our second speaker will be Prof. Kellen Kiambati. Professor Kiambati is a social scientist from Kenya, specializing in pandemic response and community engagement. Her work turns out research finding into practical action. Prof. Kellen is an associate professor at Karatina University and an SFA Foundation grantee under the Possible Africa Initiative. She'll also be presenting for us a topic, social science evidence for pandemic policy making and the practical implication of such policy. So I'll invite the first speaker to take it on. Welcome, Teklu.
Good afternoon and karibu እንኳን ደህና መጣችሁ everyone. Thank you for joining us today. Dr. Leonard, thank you for the introduction. My presentation is titled Social Science Evidence for Pandemic Policy, Lessons from Kenya in Ethiopia. In this presentation, I will be focusing on how social science evidence shaped or sometimes failed to shape pandemic policy in Kenya and Ethiopia. My talk and all the exams I will share are based on COVID-19 related literature and policy review from both countries. And I also wanted to remind you that when I say social science, I am referring to many disciplines, including sociology, anthropology, psychology, economics, political science, and even history. Next slide, please. Here is a brief outline of my presentation. I'll begin by recognizing the social science and behavioral challenges of pandemic policy implementation to set the rationale for this webinar at first point. And then we'll say a few examples of social science evidence that were produced and used during COVID-19 and the measures that were taken in response to those evidences. After that, we'll dive into the discussion around the most important question, which is how relevant social science evidence is to pandemic policy making. Next to that, we'll identify the key gaps in the use of social science evidence for pandemic preparedness, response, and recovery policy. And finally, from those gaps, we will draw key recommendations and take-home actions for each of us as stakeholders who are both responsible for and beneficiaries of integrating social science evidence within biomedical data in policy making, not only during pandemics, but also in other public health crises. Next slide. So let's begin with the challenge. Basically, the health systems did a remarkable job in both Kenya and Ethiopia in scaling up testing, vaccination, and overall coordination of the complex response mechanisms. However, despite the comprehensive and aggressive efforts to contain the pandemic, the efforts were challenged. And many of the challenges were observed were social and behavioral in nature. First, low risk perception and cultural beliefs undermine preventive behavior. This means that people didn't always see COVID-19 as a personal trait. Second, misinformation, rumors, and distrust in authorities spread faster than the virus itself, if you can remember, and which actually weaken public health compliance. Third, socioeconomic inequalities made it difficult for many people in both countries to follow pandemic response measures such as lockdown and distancing rules, especially in informal settings. And finally, limited local ownership due to centralized top-down decision-making often made communities feel excluded from pandemic governance. Those challenges didn't mean total absence of social science evidence in COVID-19 response, but underutilization of it. Let's see a few examples from the literature that assures the critical role of social science evidence to informing context-specific and practical interventions. Next slide. In fact, A few social science evidence played a critical role in shaping policy response during COVID-19 in both countries. In Kenya, in Ethiopia, rapid socioeconomic and household surveys revealed severe income and food security shocks following lockdowns. Evidence also showed that women, but I think also men, working in informal settings informal sectors like street vending and daily labor were disproportionately affected, losing jobs and income sources faster. The government and partners in both countries try to respond directly to those evidences through interventions that address food insecurity. In Kenya, for example, emergency cash transfers were rolled out to vulnerable households. In Ethiopia, a meal sharing initiative, Ma'ad Magarat in Amharic, was introduced to distribute food items to low-income households. Next slide. Further evidence identified low risk perception, high vaccine hesitancy, and misinformation among the youth in both countries, especially through social media. In Ethiopia, cultural and religious beliefs also played a strong role in shaping vaccine attitude. Policy responses to those evidences were also very, very interesting. In Kenya, for example, youth were mobilized through peer-led social media campaigns to counter misinformation. Next slide. In Ethiopia, top religious leaders were engaged and worked closely with the government through the Interreligious Council, even holding joint national prayer live streamed on state TVs to reinforce public trust and vaccine acceptance. And those examples simply indicate the untapped potential of social sciences. And let's look at some more practical relevance of social science evidence to pandemic policy, if we could use to the maximum. Next slide. Yeah, first, understanding human behavior is as important as knowing the biology. And social science in this regard, social science evidence helps us understand why do people comply or not comply with public health guidance. For instance, hesitance to wear masks or take vaccines often stemmed from social meanings, misinformation, or economic pressure, not just ignorance. Second, public trust in the health systems or the government is crucial for people to obey pandemic response rules. Social science evidence reveals the social relationships and trust networks that determine compliance. Studies in both countries show that community health volunteers and religious leaders were more trusted than government spokespersons, which is crucial insight for communication strategies. Third, context truly matters for the success of pandemic policy. Why some interventions failed in some countries while they were effective in other countries. It is context, right? For example, lockdown feasibility depends on factors like livelihood type and housing density, which are all eliminated by social science evidence. Next slide. Communication is another most important element for the success of pandemic policy. It is not only what you say that makes a difference, but also how you say it. Social scientists help test the clarity and cultural tone of messages. For example, replacing social distancing with physical distancing made a big difference in how people perceive the guidance. Fifth, pandemics magnify existing inequalities and vulnerabilities. Social science evidence helps us identify who is most at risk socially, economically, and psychologically, not just epidemiologically. Data on gender, class, ethnicity, and disability guide fair resource allocation, and inclusive recovery planning. Finally, learning and policy adaptation are critical in pandemic policy implementation. Social science evidence helps us bridge the gap between policymakers and the public by creating real-time feedback loops. It doesn't only track how people respond, but it also clarifies what communities need to know and equally what policymakers must hear back to adapt their interventions effectively. Next slide. Yeah, so despite all those demonstrated relevances, several gaps remain in how social science evidence has been used to inform pandemic policy in both Kenya and Ethiopia. The first major gap is that social science input has been ad hoc and reactive rather than systematically institutionalized. This, of course, resulted in poor utilization of social science evidence. During COVID-19, social and behavioral insights and response adaptations often came after key policy decisions had already been made, such as lockdowns, school closures, and vaccination campaigns. This means that insights about people's livelihood, trust, and cultural context were used to explain outcomes after the fact instead of shaping strategies from the beginning. The other gap is the weak linkage between social science and public health units. Structurally, those disciplines often in public universities sit in different faculties or even separate campuses, which limits opportunity for students and researchers to interact, exchange ideas, or initiate collaborative projects. Functionally, while a few cross-disciplinary courses exist, there are rarely joint field practices or integrated research projects. As a result, biomedical and social scientists often work in silos. Public health teams focus on transmission and treatment, while social scientists analyze behaviors and community dynamics after interventions are rolled out. And most importantly, limited funding continues to constrain social science research and meaningful community engagement. Funding funding priorities during emergency tend to favor biomedical responses, as you remember, testing, vaccines, and logistics, while social inquiry, behavioral research, and community feedback systems received little or even no support. This restricts the ability of social scientists to conduct timely, participatory, and locally grounded research that could have guided more effective research communication and equitable response strategies. Next, please. So as we close, I would like to have I would like to leave us with some key take-home actions, practical steps that each of us as different stakeholders can consider in strengthening the integration of social science evidence into pandemic preparedness, response, and recovery. For policymakers and health ministries, uh, the first goal is to institutionalize social science capacity within national emergency management system. This means establishing permanent interdisciplinary unit that brings social, behavioral, and biomedical expertise together, not only during crisis, but as part of routine health system planning. Those units would ensure that social science and epidemiological evidence are combined from the start to interpret not just the spread of virus, but also the spread of information, fear, and trust. Secondly, engage communities early and continuously. Don't wait until a crisis peaks. Early and sustained engagement through trusted community structures like religious leaders, community health volunteers help build public legitimacy and trust, which are real foundations of successful policy implementation. For biomedical researchers and research institutions, collaboration is key. Social and biomedical sciences must move from parallel tracks to joint pathways. working together to help reveal not only whether intervention work, but why they work or fail in a specific context. Beyond collaboration, research institutes should also strengthen their internal social science capacity, whether by hiring social scientists, integrating training modules, or promoting interdisciplinary mentorship. For funders and health partners, there is a strong need to invest in social science research and community engagement mechanisms, and not to treat them as components, to treat them as core components, not as add-on activities. During COVID-19, millions of dollars went into laboratories and logistics, but very little to understand human behavior, trust, and communication. Funding should explicitly include budgets for community engagement, rapid behavioral assessment, and participatory policy dialogue. Those investments pay off by making interventions more effective, acceptable, and sustainable. Finally, for us as social scientists, we must also be proactive to communicate our findings in policy-friendly ways, build partnership across disciplines, and demonstrate the practical value of our work. Our role is to make social science evidence visible, usable, and timely. This means moving beyond publications to co-design interventions, advising policymakers, and ensuring that community voices remain at the center of pandemic and health emergency responses. Next. Finally, I would like to acknowledge the many institutions and individuals whose work informed this presentation. Thank you, teams from those different institutions, Africa Pandemic Sciences, Mastercard Foundation, Science for Africa Foundation, from University of Oxford, Pandemic Science Institute, from the National Public Health Institute of Kenya, and the Armauer Cancer Research Institute. And special thanks to Dr. Ndalamoga Disa. He is a lead scientist at AHRI, and Dr. Leonard Kingora, AG Director, National Laboratory Sciences at Kenya National Public Health Institute. Thank you for supporting me in this journey. And Janet and Uzma and everyone, thank you so much. And I look forward to Professor Kellen's presentation and the discussion after that. Yeah, back to you, Dr. Leonard.
Thank you, Teklu. Professor Kellen is not in, but we'll listen to an audio recording of Professor Kellen, and then after that, we'll start taking the questions and comments.
So thank you so much for having me this afternoon. My name is Kellen Kiambati. I am a social scientist. I teach at Karatina University in Kenya, and I am also a Post-Africa grantee undertaking research on pandemic preparedness capabilities and sustainabilities of universities in Kenya. And this afternoon, I'll be here to speak to you through my experiences through that research process and how, as researchers, we can influence policy-making space with our research evidence. And so straight away then to my presentation, and thank you, Teklu, for setting the stage. I will be speaking to you about social science evidence for pandemics policymaking and sharing with you practical implications that I have learned from my postdoctorate research work, which I have really enjoying undertaking. So the first thing that is important for us to appreciate as scientists is that wherever we are looking to influence the policy space with our research evidence, whether for policy uptake or for interventions uptake, if you're carrying out research to address pandemic issues, is that usually the starting point, and from my experience, is to appreciate the policy context that we carry out our research as researchers. And one of the reasons why it is important to appreciate the policy context is that in that particular policy space, where you're seeking to have your evidence, your research evidence influence as many players, and those players have their own competing interests, they have their needs that they are looking to address depending on the sector in which they are playing. But most important also their power plays that as a scientist, as a researcher, you should be able to navigate. So that at the end of your research, you'd be able to measure your success and see how exactly you influenced, what are the success rates, what would you take as your key takeaway as a scientist. And in the process of appreciating the policy space is first of all to appreciate how the policies are made, what processes are followed, what steps are followed, right from making the decision to come up with either a new policy or review an existing policy, how that policy is implemented and what it takes in terms of the stakeholders to support the implementation and the resources that are deployed, both financial and non-financial resources. But then as you realize, as you implement that policy, you also must monitor and evaluate its implementation so that you're able to measure the success story. But then, of course, from that monitoring and evaluation evidence is what helps to set the agenda for the next cycle and to formulate another policy and so on and so forth. But then important to appreciate, as you're looking at this policy space, like I said in the introduction, there are various players in that space. There are those that are serving in the cabinets as executors. There are parliamentarians who make registration to support the implementation of the policies that you're seeking to influence as a scientist. There are ministries that do the implementation. Most important, there's a private sector that is looking to have an enabling environment to help them to carry out business. There's a civil society that is interested in issues to do with rights and how those rights are being observed and whether there are any violations. But we also have donors that are supporting us, and the donors also have their own interest in their own needs. So in the process of going through the policy space, it's important for you to realize that this space has all these players that we have talked about, and the players have their own needs. They have powers that they carry, and those powers influence differently in terms of the interests that they are seeking to fulfill. And those interests are not usually very linear, so that you move from one partner or stakeholder to the next, and you fulfill their interest and move on. They are competing, and they keep changing from time to time. And it is important for you as a scientist to know this is the kind of space you will be finding yourself in as you carry out your research, as you give your interventions, as you propose your interventions, and as you use your evidence to influence policy change. And really having the skill and the posture to be able to navigate this market space, as you can see from my screen, is what is important. Therefore, then, what are we supposed to do as scientists, or what are the practical steps that we can take to be able to ensure policy uptake or even intervention if you're carrying out academic research or a research that requires an intervention, to ensure that intervention helps the Society for Sustainable Development. So from my postdoc research work, I have identified a few strategies that I've seen work, and one of them is to ensure co-creation. So for policymakers to ensure this step of ensuring the researchers and the policy actors, and even policymakers for that matter, co-create research from the research design all the way to the end of the research, and making it a little mandatory, so that we ensure we researchers are engaging all the necessary constituents in the space we are operating, and we are also seeking to address the real needs through a place of mutual understanding, because it is that mutual understanding that will help us to ensure the outcomes of our research translate into effective and actionable policies that can for sure contribute to sustainable development solutions. So for me, ensuring that policy and policymakers make co-creation a mandatory stage in the research projects is one of the lessons I have learned from my research work. The other very important research lesson and strategy I have learned from my research work is finding a way of institutionalizing the use of stratified local structures. And I come from a point of social legitimacy. And social legitimacy is so important in ensuring that we as researchers leverage on the existing structures and existing policies and institutions to ensure there's credibility and acceptance, and most important, sustainability of the interventions that we propose. So leveraging on these existing structures is so key so that you can have that social legitimacy and so that also communities can be responsive and you can navigate the realities that communities are dealing with as a scientist as you seek to influence and to churn out interventions and also to influence policy in that particular space. The other very important lesson I have learned is the issue of social listening. We have to remind ourselves as scientists that when we are carrying out research, we are either coming up with interventions or seeking to influence policy change to improve our communities. And therefore, social listening is so key in terms of our understanding and capturing the community concerns. One very good example I found as I was reviewing literature for my research work was what happened in Liberia during the Ebola season. There were so many interventions that were raised, and one particular one I want to pay attention to was the relationship between the intervention of using PPEs and the social-cultural practices in that particular context. Initially, the government in that country, according to the evidence that is documented, intended to ensure that people do not handle or mishandle dead bodies during the Ebola pandemic. But then they realized with time that the social cultural practices were so enshrined in the community that people were willing to defy even the interventions that were provided in order to ensure they give their loved ones decent send-offs. And therefore then, as a result of social listening, they had to reverse the policy and make a decision to not only focus on behavior change, but also to provide PPEs so that the communities, because of their social cultural practices, could use those PPEs to provide their loved ones with a decent send-off and at the same time respect their social cultural practices. Therefore then, we as scientists, in order for us to provide interventions that work, interventions that provide solutions to the societies, it is important to ensure we have social listening as we carry out our research and respect some of those well-enshrined social cultural practices that are likely to make our interventions not exactly work as envisioned. So that's intervention, and that policy intervention from the Ebola outbreak in Liberia is one of our very good examples I have found from my research work that we as social scientists, we can use to be able to ensure uptake of interventions and policy evidence that we are seeking to provide. Another very important lesson that we can learn, I have learned from my research work that you can apply is the element of communication and social risk communication, where we as scientists must find a way of ensuring that we adopt behavioral insights as a standard practice and not optional. Because when we make it optional, then it means that we are not helping and we are not taking a posture of demonstrating empathy to the communities that we are working with, even as we seek to influence the behavior, even as we seek to address crisis in a timely and trusted way. Therefore then, making risk communication a standard practice as opposed to an optional guidance is something that probably as scientists we should be able to practice if we are really seeking to ensure the interventions that we propose and the evidence that we seek to provide to policymakers is taken by the communities that we are seeking to assist with our research work. Very important also strategies that I have identified is the element of ensuring that our monitoring and evaluation of our policy interventions and even pandemic interventions that we provide have success metrics. The ones that we can look after our research work and for sure be able to say, this is how we intervened, these are the success rates, this is how we have been able to change communities. Therefore then, it's important at the start of our project to ensure we broaden our success metrics with communities in mind so that we can be able to say there was a shift from our research work. But most important also is the element of how we take care of the vulnerable groups in the research spaces that we are working in. How do we ensure we leave no one behind, including the vulnerable communities that we work with in our research? And so policymakers then should be able to ensure every other scientist out there carrying out research as equity screening tools that must be applied across all the pandemic interventions that scientists seek to provide for the elderly people, for people with disabilities, for people from low-income households, and even including refugees, where we find ourselves working with refugees. The main point here is to ensure as scientists, we leave no one behind with the interventions that we provide. But most important also is ensuring that we as scientists work with policymakers to guard against extractive practices where communities we are working with in our research work become sort of spaces to provide evidence as opposed to sharing with them benefits. So we must design, and policymakers must ensure research is designed in such a way that we protect communities from extractive practices that are likely to be perpetuated by researchers. And finally, is the issue of knowledge valorization, which is an extremely important aspect here. And here is how we as scientists ensure that we translate evidence from our research and even interventions into local actions. And there has to be a systematic way of doing that. Otherwise, most of the times we'll be leaving our evidence on paper, and we have not put measures in place to convert that evidence into local actions that can actually help societies to become sustainable and to solve those problems even when we are not there as scientists. So then my last slide here is on how do we then make sure that this knowledge is shared and provides practical solutions and value to the societies. Practically speaking, how would it look like? And this is what I have learned from my research work is one, as scientists working with policymakers to ensure that right from the start, we are so sure how the solution will be utilized by the policymakers. We are the owners of the research work or the interventions. Unless we are so clear to the policymakers how they will utilize the solution we are providing, then after the research project is over, they may not be able to use it. And that explains to why my first strategy was speaking to the issue of co-designing with policymakers. But most important also, sometimes when we provide evidence or even interventions, they are not targeting all the groups or the constituents in the communities we are researching with. So it is also important for us to think through who will be the targets of this intervention or the local action that we are proposing. And most important, paint a picture of how the vision will look like after the utilization by the policymakers. What should we see at the end of that solution when it is implemented? So that vision should be very clear. And most important also, be very, very clear the players in the policy space, in the context that you work with. And the reason why it is important to be clear of the policy players that you work with is for you as a scientist and working with policymakers together to ask yourself, do they have the competencies to be able to action the actions that you're leaving behind, even after the project is over? So that if they do not have the competencies, then strengthening their competencies could be one of the interventions as scientists and as policymakers, we can also come together and work through. It's important to also think through step number 6, the resources that will be required. Because sometimes you can propose an intervention or a policy uptake issue where the resources are not there. So then how do we provide those resources? And in most cases, resources could be financial, but other times non-financial. It could be non-financial, like for example, working with volunteers to strengthen their capacity so that they can support once the project is over. It's important to also reflect upon regulatory framework that exists so that you're not proposing an action point that will be breaking the laws that are there, or probably that require the review of some laws so that you engage the right policymakers. But most important is to be sure we are ethical in the actions that you propose and there is sustainability way after the project has been completed. And risk management is also so key so that if there are risk in terms of perhaps, for example, disorienting the cultural practices that have been existing you have to find a way of those mapping out those risks and managing, finding or proposing ways of managing those risks. And finally, is executing the impact action plan together with the policymakers, because remember, we've already talked about co-designing. So that is it regarding the strategies that I learned from my research work. Happy to engage with you and happy to take questions from you. Thank you.
Thank you very much, Teklu and Kellen. So in the Q&A box, we have quite a number of questions, very engaging there. And one from Stella asking about early involvement of social scientists in the work, asking how early is early, if maybe the speakers can try to quantify this. The second question is about stakeholders and collaboration, and types of approaches which are multifaceted, and how these can be used to address the gaps that the presenter, who is Teklu, has highlighted. So those are two questions, all of them around the aspect of collaboration, co-creation, and how it can be used to improve work on pandemics. So maybe Teklu, while we are still doing this, you can respond to these two questions, which are kind of related.
Yeah, thank you, Dr. Salome. Yeah, they are great questions, really. Most of them are comments, I guess. The first question, how early is early? Yeah. So I think mostly during the planning strategy, as I mentioned in my presentation, involving key stakeholders during planning strategy is the key. That is the time where we say early. But sometimes for future pandemics, if we can include that practice in other public health issues. For instance, we learned that this kind of engagement were practiced in HIV, and that really helped us in other responses, in other health intervention implementation, right? So establishing that practice now, and establishing the collaboration, the coordination, and bringing the different key stakeholders in the space really builds the experience and the lessons, and that helps us actually be proactive whenever pandemic comes, and we can use the already established system if already our health system is equipped with this different expertise and already established communication channels and the data necessary for joint response, for collaborative work.
There's a question on law index of suspicion. This is a question from Kasadha Nessa, and you're asking how we can go about addressing low index of suspicion, especially in deadly diseases like Ebola. There's also a question about data. For example, when you have data like for COVID-19 and the pandemic has already ended, for analysis, considering the results could fail to be effective as the pandemic already occurred. besides guiding future pandemics, how else can one approach that? There's also a question from the DRC, from Theory, with quite a number of questions around access to information. Without an official and active unit, journalists lack a single reliable window for obtaining an analysis of the social context. So a lot of times they depend on rumors, risk perceptions, which can lead to community reluctance and all that. So this leads to a spread of incomplete or sensationalization of available information. So addressing aspects of data for specific groups of people, including journalists, government, communication, and press should be a priority area. So that's more of a comment than a question. So I think maybe we can start with Teklu to respond to what he can with what we have in the Q&A, and then maybe if we have time, we can take the remaining questions.
Okay, thank you, Salome. Yeah, very interesting questions are there. Yeah, so to start from low index of suspicion, especially among health workers. Yeah, I mean, I think we need to really understand why is that? Why even health workers have low index suspicion, even sometimes greater than the public itself. Well, I mean, there has to be, some underlying causes for that, and we need to really understand, and that's what we're saying. Such kind of issues are, issues that require social science attention, social science methodology, and social science theory that can help explain that kind of behaviors. So we scientists and health workers are part of the community. We live in the community, and we live with the community. So any other influence, it could be social media or culture or just beliefs. Uh, so health workers are also prone for such kind of uh, knowledge, beliefs. So that really needs, joint work with social scientists, and we need to engage health workers as practitioners as well, and understand their experiences, their perceptions, and from that we can also, of course, identify proper interventions also that address such kind of gaps. Uh, about the data on COVID, I don't know. It depends on the type of data, to be honest. Of course, the data I reviewed here, the literature I reviewed here, most of them are also published after COVID-19, is declared to be no more pandemic by the WHO, most of it. But those give us these important lessons. So unless we can draw from such kind of data for future pandemic preparedness, response planning, and recovery planning, I don't know what else we can do with the data that may now have some sort of purpose. For the brother or sister from Democratic Republic of Congo, most of the things are, I guess, comments, but I mean the issues highlighted. I believe those are not unique for the RC only. I mean, as scientists, we face those kinds of challenges everywhere in most of African countries. I can say for myself, yes, it is true. And I also had a opportunity to discuss with some fellows from other countries, and those are the challenges we always face. And for me, it's collaboration, and it's learning from each other and supporting each other that can help uh, 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 cope with these challenges, and uh, uh, do something about those. And I hope we'll get in contact and keep working together. The SFA Foundation is what exactly is doing, having researchers and having a platform for learning and collaboration. So we can use those kind of opportunities, and we can also establish partnership among public health universities and research institutions. Yeah, so working together actually will help. The other question is that what practical strategy can be used to increase ownership during planning and execution phase in international collaborations where global north-south power dynamics guide the decision-making process? Yeah, I guess it is listening to the community, listening to the key stakeholders who have stake on what we wanted to do. So starting the defining the problem, starting with the committee, with the stakeholders, really will help, and will help us align with the agenda. And of course, that is a long-term effort that we can overcome in future. So we have other, I think, some questions, and if anyone who wants us to also add, that will be very helpful. Otherwise, I can promise to give a detailed written response for all of the questions, and we can share them back to all participants here. Can you do that, Dr. Salami?
Absolutely. Yeah, we are happy to do the link. So for those of us who may be interested in following up with the two researchers or any other researchers here at SFA Foundation on the same, we are happy to do the link. Yeah, so that's all right. We have a hand raised, so we'll just give it one last one because we are out of time. So
yes, thank you very much, our today's presenters. It has been really an engaging presentation and really informative. My name is Kassem Nassa from Uganda at Makerere University. It is a pleasure that we have an Africa Pandemic Science Collaborative. So I have already sent in my question through the chat, but I was wondering if this is a big collaborative, because what I can say, we are many people doing different works targeting epidemics and pandemics, and then epidemics which are capable of becoming pandemics, but we are all, most of us are isolated. I'll give an example of myself here in Uganda. I'm studying Ebola in Uganda and the borders between Uganda and Congo. So is there a way this collaborative can involve students, let's say PhD students from institutions around Africa, so as we can beef up this collaboration, and so as we can, share expertise and then inform policy throughout Africa. Thank you.
Okay, great, thank you. And thank you for that question. My name is Linda Mulungi. I'm the Senior Program Manager for the Africa Pandemic Sciences Collaborative based at SFA Foundation. And thank you for that great question. Yes, we do have opportunities to engage other partners in terms of contributing to this thematic area. And we do have some Catalyst Awards, some research and innovation fellowships that we will be rolling out to our broader collaborators so that you can tap into contributing to this important topic. Currently, we have also been engaging with the epidemic and pandemic science innovation and leadership networks, which we've rolled out awards, and we have one around the social science thematic area. So I'm happy to also link you up with that specific group so that you could also engage and find ways to collaborate with that specific team. But happy to follow up with you for specifics around other areas that you can tap into this funding that we are very grateful for.
Okay, thank you very much, Linda. And so we've come to an end of this session, and I want to thank Kellen and Teklu for those wonderful presentations and thought-provoking points that have led to a really good discussion. And we are happy to say that we will be happy to connect anyone to the two presenters. If you have any follow-up question or you have suggestions about how to collaborate and work together, we are happy to do that. We are also going to inform you about a second series when it's ready and what the title will be and all the details related to it. So just keep your communication channels open for any kind of communication from us on the same. All right, thank you very much. And I hope you have a wonderful afternoon. Thank you.